So I was just talking to a therapist, an occupational therapist yesterday, and I shared with her this one strategy. And I wanted to share with you. So I know I'm coming on a lot last minute, but if you're a therapist, if you're an occupational therapist or a physical therapist and you're studying for the exam, this live is for you. There's really only one strategy, right? There's one thing, if I could tell you to focus on to help you pass the exam on the first time, this is a one thing that is going to help you. So stay tuned. If you're studying, if you are planning for November of this year, let's do it. I was talking to her yesterday and she's like, this is what I want. I've already been studying, but I kind of fell off the wagon there. And I'm like, okay, that's fine. You've been studying and you know some shit. So let's create the plan that's going to make November passable, right? I talked to someone the other day where we planned it for November, no, for May of 2023. So either way, it's possible. My plan really is it's either a 6 month, really like a good 6 months, um, like lockdown strategy to study, and then, or you could do a little bit longer, like a year. That's going to give you a lot more time, right? But if there's one thing that I always talk to people about, like focusing on, today I'm going to go into depth about it. If you didn't see the last one, go back through and watch about the resources. Going to talk about the resources in depth. And today what I'm going to do is I'm going to talk about the one strategy that you've really got to focus on when it comes to studying. And I asked her this one question because she was like, yeah, I've got the brachial plexus down. I'm like, why in the world is everyone so hell-bent on memorizing the brachial plexus? Like, somebody type into the chat and tell me why. I know it's important. I know it's important. It's built into the program, and we dive deep into it. But really, honestly, the brachial plexus isn't the only thing, and it's actually one of my things that I've done is I don't. It's not the first thing I study. It really isn't, because there's a way in which that you can build your knowledge. Like, I often talk about chunking different types of issues, like different types of topics, and then chunking not only the topics but your time. And you can chunk those topics in a way that builds upon each other. So why do you keep coming on and asking about weird shit? It doesn't make any sense. Ask me some questions on taking the exam or something that I can help you with, because these comments, so as much as I appreciate comments, they're not necessarily helpful. I'm talking to somebody who is making comments on Instagram. So sorry, I can't really help you. But if you are studying for the exam, I can help you. So the one thing that I'm going to erase this, right? The one thing that I want you to think about when it comes to exams, right? That's going to really help you. And the reason why it's going to help you on the exam is because it helps you in practice, right? The one thing that you want to focus on is treatment. And you might say to me, Huang, I've been a therapist for a really long time. I know how to treat, right? And kudos. I'm glad that you know how to treat. Here is the kicker. It's not about how you treat. It's going to be about how you could treat, how you could answer the question based on the scenario that they give you on the exam, right? And this is one of the reasons why when I talk about how you have to become that decision maker, when I was studying for the exam, I can only kind of talk about like what I did, was, I started with the whole, trying to understand anatomy, trying to memorize certain things because, and again, memorizing the brachial plexus because everyone and their mother told me that it was about the brachial plexus. But really, what I discovered was it's not so much about the brachial plexus, right? In order to get to treatment, you actually have to know several things about it, right? You have to know anatomy. And the anatomy part is that brachial plexus part, right? But how do you provide treatment? How do you know what to do with somebody? In order to know what to do with somebody, you have to know how to evaluate them, right? So if you know about, like, I'm gonna go back, go on brachial plexus since I started the conversation on brachial plexus, right? If someone comes to you and they have, let's say nerve types of issues, right? They have atrophy or they have like weaknesses or anything like that, you can, immediately what we do in the clinic is we just start treating because we think, oh, the doctor wrote that this person has this nerve issue. The doctor wrote that this person, has a compression, right? And then we just start treating them. And it's great, like, and I think part of it's like we've been trained from the university, right? From school to say like, oh, you have to follow what the doctor says. You have to do whatever the doctor says. And that's fine and dandy. Like, there's a lot of respect. I work with a lot of surgeons, a lot of doctors, and I respect them. I have lots of doctors in my family and I respect them, but we have to come to the therapy space with a certain amount of knowledge that we own as a therapist, what you know to be true about how you would help somebody in this way, right? So let's say they can't brush their hair, they can't tie their shoes, and we know these people that if somebody comes to you with a radial nerve problem, they can't tie their shoes, they can't brush their teeth half the time because they can't grip. Why? Because their wrist has a they don't have any wrist extension. If you don't have any wrist extension, how do you have any grip strength, right? So things like that. Now, if someone comes to you and you just rely on the doctor's prescription to tell you what to do, that only takes you so far in treatment. That only takes you so far in what you're doing in the clinic. What it doesn't do is help you pass the CHT exam, right? It's not going to help you pass the CHT exam because that's the difference between like what you're actually practicing in clinic and what they actually want you to be able to do on the exam. When you become a certified hand therapist, you really do need to critically think through a problem and make decisions on, what happens, with your patients, what you're going to do next, what are you going to recommend? You should be able to be that therapist, right? To become the certified hand therapist that the doctors and surgeons trust. You are the ones who, they'll go to when they're saying, hey, what's going on with this patient? And you can say, oh, this is what's going on, and this is what I'm doing, this is what I recommend, right? And have healthy conversations about like, I think that this is a good option for X, Y, and Z, and it does rely on treatment, right? So, but in order to treat, right, you have to know how to evaluate, right? And how do you know how to evaluate? How do you know how to evaluate? You've got to know some anatomy. So when it comes to studying for the exam, where I see a lot of people get stuck on is this anatomy part. Like, I've got to memorize stuff. And then what happens is you're so stuck memorizing that at some point you're not applying your anatomy. So when I say that you know a lot of stuff, I mean you know a lot of stuff, right? And here's the kicker. You've got to be able to apply it to say, how would I evaluate that? Not just in the treatment room, not just in real life, but how would I evaluate that on an exam? How would I evaluate on an exam? We see people in 3D, right? I'm gonna touch you, I'm gonna feel you, I'm gonna press, press on this. I'm gonna know exactly what to look for. If I don't see wrist extension, then what's the next muscle that I'm looking at to identify to see like at what level is that nerve injury occurring at, right? I've got to learn, I've got to know how to evaluate it, but I've got to put those into words, into scenarios, into questions, right? And then I have to know the prognosis. Like, what's the likelihood what's the likelihood if we apply treatment that we would get the outcome that we're hoping for, right? What is the prognosis? What are the complications that can happen if we don't do the thing that we need to be doing, right? So if I'm talking about a radial nerve type of injury, if you've been studying or you're in the hand therapy realm, you might think, very first thing is wrist drop, right? But you have to then go backwards and say, okay, which muscles, which nerve. You're gonna have to say what's the timeline for this. You're gonna have to say, for example, what are the complications of this? And it's not just the splint, but you have to understand the why. Why would you put this splint on? What are the options? Because on the exam, now I'm just talking about on the exam, right? Because sometimes what we do in practice and what we do on the exam or what we're studying is just it's slightly different. And here's why it's slightly different. When you practice, it is evidence based for the most part. As long as you understand why you're doing what you're doing is evidence based. Goes back down to anatomy, goes back down to like healing properties of whatever the injured parts are, right? And then it goes down to like the evidence is the applied treatments that you can essentially provide, right? That's evidence based. There's a lot of evidence for all the things that you do, even if you don't know them. Right? We don't have to have like a study for every little thing that we do, because honestly, we're human beings, and you can't just test everything. You can't just do research on every little thing that's actually significant, right? I'm digressing, but what you do need to know is I totally lost my train of thought. What you need to know is to be able to work from this wrist drop, you have to work backwards to anatomy. You have to know how to evaluate it. You have to know what are the complications so you can get ahead of a particular problem. And then you have to know what are the treatments that you're going to apply. Because at the end of the day, our patients come to us for a particular outcome. They want to know why. They want to know if it's possible, right? Well, how many of your patients ask you, why is this happening? How many of your patients ask you, when is this going to get better? And there's other questions that they might have that they don't know how to ask that, which is, what happens if it doesn't get better? And these essentially are the questions that you can be answering. The difference between, the test and clinic is, in the clinic, you have the ability to try several different methods, even if you're not exactly sure what's going to work and what's not going to work, right? In the clinic, you have an opportunity to try, and you get to try as many times as that patient is willing to come into, to you, for you to help them, right? So you could try a splint. You can try several different splints. You can try several types of treatments. On the exam, they're going to ask you a very specific question, and you only get one chance for the most part. There's 4 choices. You're going to rule 2 out, essentially, like that maybe they don't make any sense to you. But there's a strategy to being able to rule in 2 and keep 2, and then rule down even further to pick the best choice, to pick the best answer. Now, every choice is on the exam. It's not wrong, right? It's not wrong. So they're giving you choices to pick from, and especially in terms of treatment, it's not a wrong choice. It's just not the best choice. And therein lies the biggest difference between clinical work and what you need to do to pass on the exam to become a certified hand therapist. In order for you to pass, you've got to make critical decisions, right? And one area that I have noticed when I do our score audits and when I am going through the curriculum with my students is that everyone gets lost. Like everyone loses treatment. And part of it, I wonder it's because we do the treatment and we don't think of it as a way of them asking questions about treatment. Correct me if I'm wrong. Leave me a comment, leave me a note, tell me something, right? Slide into my DM and tell me. But honestly, when you guys are studying, or one of the things I've noticed, whether it be with students that are in the program, in the last several years, or I've kind of thought back to, some of my staff, some of my OTs who've, studied and failed before coming in and working with me here. Um, Whether I think about how OTs, come into my clinic and I train them, like I have to train them in terms of how I work in my clinic and how I want them to think in my clinic. And one of the biggest things is like we tend to, because we do treatment, we tend to almost like dismiss it as if, oh, that's just the thing you do, And that was something I did when I was a new grad. I watched people. I copied people, and I didn't fully really understand everything that I was doing. And when I started to study for the exam, it was one of the biggest things that I started to notice. I started to notice that as I was studying, not only did I memorize things, but I applied things. I applied my knowledge into certain cases that I would have. And I had to think through, why am I doing this particular exercise? It didn't necessarily, like, there was this one thing that I would do. Like I would do like for example, carpal tunnel people. What do they come in and tell you? Oh, my hand is weak, it feels weak. But are they actually weak? Not really. But I didn't know that. I thought they were weak, so I would do a lot of grip strengthening with them. Turns out that's not the best thing to do with carpal tunnel people, right? It's not the best thing to do with carpal tunnel people. I didn't really understand that until I studied anatomy. I really fully learned how to evaluate and apply that anatomy. And then the prognosis is pretty much like if they come to you at this stage, you can help them. If they come at a later stage or a post-surgical stage, this is how you'd help them, right? That's like different stages. But then how would you treat that? Like, so if they came to you early, in the early stages, how would you treat them? If they came to you post-surgical, how would you treat them, right? And so you have to be able to critically think through all of those types of scenarios, because that's what's going to be on the exam, right? And what's on the exam is actually really helpful for you from a clinical standpoint, right? Because once you understand, you'll be able to think from anatomy all the way to treatment, but you'll also be able to think from treatment. What am I currently doing with my patient, and does that actually really help? Because it's not about the technique. It's not about the technique necessarily. There's a lot of techniques you might be learning. You might be learning taping techniques. You might be learning to use instrument assisted. You might be learning how to cup. These are all like different types of modalities. You might be a person who loves ultrasound. You might be a person who loves using electrical stim. You might be a very exercise based person or a very manual therapy based person. And it really doesn't matter how you treat in the clinic. You can treat how you want to treat. I have a very particular way of treating in my clinic. Most importantly, I have a very particular way that I want, that I do, and also my therapy staff does, is how we critically think through any type of case that comes our way, so we're not necessarily reliant on just a prescription to tell us what we need to do and how we need to do it. But we can also, because we have a very particular way of critically thinking through all the particular problems, we know how to have really great conversations with the doctors and the surgeons that refer to us, right? And we do it in a way so that they can feel very confident that we know how to help their patients. We know what to do after post-surgery, so we don't mess up the surgery, so that we can get our patients great results. That takes critical thinking. That takes being able to apply what you know from anatomy and apply what you know about surgical techniques, and be able to kind of like dive into like what can work, what's the prognosis, like what can go wrong, what can go right, and what can go wrong. That's essentially prognosis, right? How long are things going to take? What would I expect? And then how do I treat that so I can get that actual outcome? Treatment. So if you're studying to become a certified hand therapist, that is the one strategy, that is the one thing that if you can constantly remember, it's going to help you pass the first time. It's going to help you pass the first time, right? If you're studying, this is your first time here, you've not seen my face, you've not heard me speak before, my name is Huang. I'm an occupational therapist and certified hand therapist, and I help other therapists study and pass CHT. If you're looking to get some help because you're stuck, you try to read on your own, you just don't, you don't get it, you're stuck, you want to be able to ask questions, you want to be able to get detailed explanations, you want help to like get focused in the right areas, right? So you don't get stuck just like memorizing stuff but not being able to apply it. I can help you. We have the hand exam prep program is currently open right now for enrollment. You can apply through the website at handtherapysecrets.com. I'm leaving the link for you. So if you're on Instagram, you can go into the link in the bio section and apply there. But if you are looking to study and to pass the first time around, pay attention to where you want to put your focus on, okay? Put your focus in the right places. Be held accountable to make sure that you're studying all the different areas and different topics in a way that is going to help you pass, right? And if you need that kind of help, my name is Huang, and I can help you through our hand exam prep program. So let me know what you think about this talk and how I broke down some of the things that you want to, consider as you're studying, right? And if you're looking for that accountability, just looking for that structure and that curriculum that's going to take you through all the topics and all the chapters of the rehab of the hand, know where to find me. You can slide into my DM if you're on Instagram, send me a message. And if you're on Facebook, on YouTube, definitely click the links that I'll be providing. But if they're not there, it's handtherapysecrets.com. All right, I will talk to you guys soon. I hope this helps you. Send me a message if it did. All right, or leave a comment below. All right, I'm off. Bye.